Good morning. This is Dr. Tarek. Today I'm going to discuss some more questions about phlebotomy certification examination. Let us begin. Number 1. Dermal puncture are performed on options are veins, arteries, capillaries, arterioles. The answer is C. Capillaries. The depth of a heel puncture should not be more than options are 3 millimeter, 2 centimeter, 2 millimeter, 1.5 centimeter. The answer is B, 2 millimeter. Which finger is most likely used for capillary collection? Thumb, ring, index, pinky. The answer is C. Ring finger is most commonly used in dermal puncture. Next, in performing a dermal puncture, the puncture should be options aligned with the whorls of the finger, perpendicular to the whorls of the fingerprint, on the edges of the finger, on the tip of the finger. Aligned with the whorls of the fingerprint, perpendicular to the whorls of the fingerprint, on the edge of finger, on the tip of the finger. The answer is B, perpendicular to the whorls of the finger. It gives a good drop and does not mix in the between the finger whorls. In a dermal puncture, which test is collected first? Electrolyte, blood smear, platelet count, or CBC? The answer is B, blood smear. Which test cannot be collected by dermal puncture? Options are glucose, blood culture, CBC, platelet count. The answer is B. Blood culture cannot be collected by dermal puncture. Next, an infant heel warmer, an infant heel warming device should be applied for approximately how much time? Options are 1 to 2 minutes, 8 to 10 minutes, 30 seconds, 3 to 5 minutes. The answer is D, 3 to 5 minutes. The location for heel sticks is the option center of the plantar surface, medial and lateral borders of the plantar surface, posterior surface of the foot, or arc of the foot. The answer is B, medial and lateral borders of the plantar surface. Next, bleeding time test. These are some questions about bleeding time test. Which medication does not interfere with bleeding time test? Options are ethanol, ibuprofen, aspirin, acetaminophen. The answer is D, acetaminophen. Next question. At what level does the blood pressure cuff remain during a bleeding time test? At what level does the blood pressure cuff remain during a bleeding time test? Options are 20 mm of 20 mm of Hg, 10 mm of Hg, 50 mm of Hg, 50 mm, 40 mm of Hg? The answer is D, 40 mm of Hg. A normal bleeding time test result is option 30 to 45 seconds, 2 to 10 minutes, 15 to 20 minutes, 1 to 2 minutes. The answer is B, 2 to 10 minutes. Next question. How frequently is the blood wicked during a bleeding time test? Every 5 seconds? Every 10 seconds? Every 30 seconds? Every 45 seconds? The answer is C, every 30 seconds. Next, which of the following has a higher value in the capillary blood as opposed to the venous blood? Options are potassium, calcium, total protein, hemoglobin. The answer is D, hemoglobin. Which of the following has a higher value? I am repeating the question. Which of the following has a higher value in capillary blood as opposed to the venous blood? The answer is hemoglobin, D. 10% bleach as a cleaning agent every should be made fresh every week, every 3 hours, every day, or 6 hours. The answer is C, D. C, every day. It should be made every day. Anything left for today should be discarded and next day should be made fresh. Last question. The percentage of the blood should be A percentage of the bleach should be 1 to 20, 1 to 10, 1 to 5, 1 to 15. The answer is B, 1 to 10. 1 into 10. This is all for today. Thank you. Have a good day.